Hi everyone! So today we're going to discuss about dementia, and I'm going to give you a very brief background of what dementia is, some subtypes of dementia, and then we're going to move on to the difficulties that individuals with dementia could face. I'm going also to discuss about the difficulties that the caregivers could face, and then I'm going to bring two interventions that have shown the most promising results according to research studies. So, to begin with, dementia is a syndrome, not a disease, as most people would think, of a chronic and progressive nature, and it does arise due to brain disease. Some of the difficulties that we see are mainly in cognitive functioning, such as memory or concentration or even thinking of the individual. The subtypes of dementia could include dementia in Alzheimer's disease, which is considered one of the most dangerous types of dementia, and that's why it's also the most popular one. Then we have vascular dementia, dementia in other diseases like Parkinson's disease or Pick's disease, and unspecified dementia. So moving on to other difficulties that the individuals could face, which are most of the times neglected because we focus on the cognitive functioning, include activities of daily living or their quality of life. When an individual is actually facing some difficulties in their cognitive functioning, it goes without saying that their quality of life could be affected. Some neuropsychiatric symptoms might also become evident. Those include depression or apathy or even agitation. And because they do have those symptoms, they become more dependent on the carers, on the caregivers. So what happens is that the relationship between the carer and the individual with dementia is facing some difficulties. So after those difficulties become apparent, then the caregiver has more burden on them. So most of the times what happens is that institutionalization of the person with dementia is enhanced. So those are some of the things that we need to consider when we think of a person with dementia. Now, when we move on to the carers, we also need to think of how it affects them. And what we often neglect is how their quality of life is also affected. So by that, we mean that around 36% of individuals that care for someone with dementia actually spend around 100 hours a week to care for them. And because they spend so many hours of their week caring for someone else, they forget to care about themselves. So they also face some difficulties in their activities of daily life because they tend to forget about their priorities and they put the other individual as the first and foremost priority. So we see that those individuals might also have some job difficulties because they spend so many hours caring for the individual, and they also face some social difficulties. So we have we have physical difficulties because 48% of them have also suggested that they are suffering from a long-lasting illness. So we need to be aware and mindful of all those things that the carers are also facing. So when we think of the importance of dementia, what comes to mind is research studies. And actually research studies have shown that the mortality rate of dementia is even higher than certain diseases, like ischemic heart disease or cerebrovascular diseases. So dementia is placed as one of the priorities that we need to look at. The cost is also quite high, so we need to be mindful of that. And another reason is that 1 out of 3 people actually in the UK will develop dementia. So we need to be mindful of all those factors and take into account of them when we think of interventions. So now I'm going to move on to the interventions that could be provided for the individuals that might have dementia, they're in their mild or moderate stages of dementia, as well as the caregivers. One such is cognitive stimulation therapy, and the aim of this intervention is exactly what is suggested from the title. So the aim is to stimulate the cognitive and social functioning of the individual. And that is very important because we need to be mindful of the fact that around 70% of individuals live in the community. Therefore, stimulating their psychosocial functioning so that we can integrate them back into the community is very important. Cognitive stimulation therapy is provided in groups. Around 5 to 8 people are present in the group setting, and it is held twice a week for 45 minutes for a total of 14 sessions. So in cognitive stimulation therapy, the activities that exist is anything that can stimulate the individual. So from solving puzzles or even baking. So this intervention is very important because it has also been translated in many different languages, from Japanese to Spanish to Italian. Therefore, it shows that it's highly promising, and that's why it has been researched so much. So it has also been shown to be cost-effective, which is another important factor as we discussed previously, because the cost of dementia, especially in the UK, is quite high. So it is promising in that area as well. When we move on to the results that it promotes for the individual and the carers, it actually has shown quite promising results in terms of their mood, their quality of life, their activities of daily living, as well as the care burden, which all those factors are very important when we are dealing with an individual that has a lot of difficulties within their activities of daily living. They're facing some mood changes, some symptoms of depression or some agitation. All those factors need to be addressed, and this intervention is very important in addressing those issues. The next one I would like to discuss is cognitive rehabilitation, and this intervention aims to rehabilitate the individual specifically in their activities of daily living, and it places focus on the activities of daily living that the carer and the individual with dementia believe are more important in daily context, rather than solving certain cognitive tests. So that's where the focus is placed. Cognitive rehabilitation is very important because, as we mentioned before, the individual becomes more dependent on their caregivers, and that's because their activities of daily living are reduced, their quality of life is also reduced. So what happens is that the relationship between the carer and the individual would face, unfortunately, some difficulties. Because we have difficulties, the burden that the caregiver feels is even higher. They then also have to face some psychological difficulties, some physical difficulties. So what becomes very apparent is that the individual feels that they're not able probably to take care of them, and institutionalization becomes now the first priority. So this intervention has shown quite promising results in terms of activities of daily living. The individuals become more independent, they take care of themselves and are more ready to do that. So that's very important, because then the carer can also find some time for themselves, they can go out, they can have some social stimulation. So those factors are very, very important when we talk about the relationship between the caregiver and the individual with dementia. So the results of recent studies have actually shown promising results of even improvement for up to 2 years for caregiver burden, also improvement up to 2 years for the individual with dementia that is having some difficulties in their activities of daily living, as well as in the neuropsychiatric symptoms, what we mentioned about depression and agitation and apathy. Those factors are all very important. And the last thing is that it has also shown a 2-year improvement in institutionalization, which shows that if we do take care of that, if we do intervene at some stage and we do provide the intervention so that the individual can become more independent and they can take care of their lives and take back their lives, let's say, it can produce quite promising results. So today we discuss about what dementia is, some subtypes of dementia, the difficulties that the individual with dementia and the caregivers could face, the importance to address dementia, especially in the UK, and some interventions. Those included cognitive stimulation therapy and cognitive rehabilitation. Okay, so I hope you found this video helpful. If you are an individual that has been diagnosed with dementia, or if you are a carer that is helping someone with dementia, hopefully you can guide them to the right direction by telling them that those are some of the interventions that have shown promising results. Thank you.